Dr. Purvi Paikh, thank you so much for being with us again on ITV Gold. How are you doing today?
I'm doing great. How are you?
Not too bad. New York City is still under 1% positivity rate, so we're just hoping for the best here. Let's dig right into it, Dr. Paikh, because so much is happening in the nation, and we have a lot of questions today, especially related to science. Just starting off this interview, I want to share some numbers coming in today. There are nearly 6.7 million cases of COVID-19 in the United States with 197,000 deaths. As we approach almost 200,000 deaths in this country, Dr. Paikh, do you think we're out of this pandemic, or are we in the second surge of coronavirus? I would love for you to address that.
Right. No, I don't think we're out of the pandemic yet by any means. Even with the 1% positivity rate, I personally know 2 people who have tested positive for COVID-19 in the last 2 weeks. So people, unfortunately, are still getting infected. Thankfully, it's much, much less than what we were seeing in March or April or May, but we're nowhere near out of the woods yet because the virus is still here. It's not gone. So we still need to keep our guards up. I don't think that we're in the second surge yet because the infection rate has stayed so low. But if we see that infection rate going back up again, like what we saw in March, April, May, then yes, that would be the second wave or the second surge. But right now we're still just finished with the first surge, and 1% is great. And I'm hoping it stays that way.
Yes, for sure. When would you anticipate this second surge will happen, if it does?
So, many people are predicting that maybe in late fall or winter, the second surge might happen. And the reason is because we know that the virus spreads more in indoors and in enclosed areas. So right now, many of us are outside, we have our windows open, and that really helps decrease the spread of the virus. But my worry, and a lot of other people's worry, is that once it gets colder and people are more spending more time inside, then the virus is more likely to spread more quickly. Also, if people start increasing, activities with large groups of people, or start letting their guards down, stop social distancing or traveling more, that also might contribute to it too, especially around all the holidays.
My question, just dealing with the surge of cases right now in the Northeast, it is somewhat handled. It is being maintained right now. Luckily, in New York, at least we are maintaining less than 1% positivity rate. However, there are parts of the nation that are surging in case numbers. Do we have to be concerned about that? Or is this something that you also anticipated, that eventually pretty much all of the states will see some kind of a surge of COVID-19 cases?
Right. It's very different region by region, because I think a lot of the mandates are very different. So, in New York, we've had the mask mandate since April, and I think that's helped decrease a lot of the transmission. Also, we have been very, very slow to reopen. Many businesses are still not open. So I think that's helped keep the numbers low, but other parts of the country are all doing different protocols. So they may see surges sooner. I think that's why we are still seeing a lot of cases and increasing cases in certain areas. As you know, there's almost 35 states that Governor Cuomo and Governor Murphy are requiring quarantine from. So that's quite a lot. That's a big number. So I think, unfortunately, until everybody follows, similar guidelines, it's going to be difficult to have everyone on the same page.
Yeah. So when we're talking about these surges, Dr. Paikh, why do you think, what is leading to the spread of the disease in different parts of the nation? And, for these 35 states that are on this quarantine list, what is your advice to them?
Right. I think it's a lot of different factors. We were very careful to wait until the infection rate came very low before reopening. A lot of these other states didn't wait for that. They reopened even as the case numbers were still high or not fully decreased, so they didn't even wait for their first wave to be completely over before reopening. So I think that was an issue. Also, there's still not mask mandates in a lot of places. So that's another problem, because depending depending where you go in the country, not everybody is wearing those masks. And believe it or not, that decreases the transmission rate by 70%. Some people even call it a crude vaccine because it's so good at preventing the spread if everybody's wearing it. So my advice would be, just wear those masks, keep your distance, keep up the frequent hand washing. I know people are concerned about their work because the economy is so bad, but try your best, at least for non-essential things, to follow those guidelines, because those small steps can actually decrease the spread quite a bit. And the same goes for travel and large gatherings. I know people are getting tired of being on the lockdown. So, people are now going to parties and weddings and events like that. And I know that everybody wants to, but it may not be worth the risk.
Definitely. Let's talk a little bit more about coronavirus developments, especially looking at the vaccine. It's been in the news this whole week, especially this whole month, in terms of the pharmaceutical companies that are involved in it, in terms of the pause in one of the trials. But my question to you is, right now, they're estimating this vaccine to be available by mid next year in 2021. And for, for all of the Americans to be vaccinated, they're estimating all of 2022. I would love for you to give us insight into what's exactly happening in this vaccine trials, and when can we expect this? Because obviously the eyes are on this vaccine.
Right. So, at least in America, there were 3 companies that were in phase 3, which was the last step before FDA approval, where people can start getting vaccinated, limited groups can start getting vaccinated. Unfortunately, AstraZeneca has paused their trial as of, I think, September 5th or 6th, because they were investigating an event that occurred in Europe, with one of the vaccine participants. And even though other places have resumed for AstraZeneca, like in Europe, and I believe South Africa and some other places, the US is still on hold because the FDA wants to further investigate to make sure it's safe to proceed. And I think that's the right step. But that being said, there's 2 other studies that are still going very strong. So both Pfizer as well as Moderna are also in phase 3. They're actively recruiting many, many participants. So I'm hoping that at least one of those 2 will be approved by the end of the year. And then, yes, I think it will take, most of 2021 to get everybody vaccinated, because this is the first time in history that the whole country, the whole world is clamoring for the same vaccine. So, there's a big concern about the supply and demand of the vaccines as well. So hopefully, we will have a safe and effective vaccine approved at least before 2021, so that we can vaccinate everybody in that time frame. The exciting thing, though, is that this has never been achieved in history, that these companies have already enrolled close to 20 or 25,000 people each in just 1 month or 6 weeks of being in phase 3. So it's a very exciting time as well for science and innovation.
When talking about this vaccine today in the news, there was news about the fact that many health experts are saying that the efficiency of this vaccine depends upon how many people get vaccinated. What are your comments on it? And with the flu vaccine already available and the flu season also approaching it, do you see them impacting each other at all?
Right. So, that's a really good question. The more people you have that get a vaccine, the better if it works or not. So, if something works in 10 people, it's not as good as if if it works in 30,000 people or 50,000 people. So that's the whole idea behind doing these large studies, because we want to make sure it works in everybody, not just in a small group. And we want to make sure it's safe and effective in everybody, because not everyone may react the same. So the first 10 people may have a different experience than, person number 17,000. So that's the importance of the wide scale testing before anything is approved, to know if it definitely works and to know how safe it is and what side effects there are. Now, flu season is coming, and we're already started vaccinating people for with the flu vaccine. And I encourage that everybody get it, because the last thing that we want to be dealing with is 2 pandemics at once. response, because even before coronavirus or COVID-19, the flu season has always been very bad. We see a lot of deaths, a lot of children die, a lot of elderly people die. So that's something we already have a vaccine for that we can prevent. And the flu vaccine has shown to be very effective in preventing flu deaths and flu hospitalization. So that everybody should get, because it will help them protect them from getting sick.
Would somebody who has COVID-19 symptoms, let's say mild symptoms, and they haven't properly gotten it yet, could getting the flu, expedite that process of getting COVID? Do they have any interactions with each other?
Right. So, that's also a very good question. So there are two different viruses. So one might not make you more susceptible for the other, but what might happen is, because both have very similar symptoms, if you get sick, you won't know, okay, is this flu or is this COVID-19? And then you would have to go and seek, medical care, either in the doctor's office or hospital or ER. And when you do that, you're putting yourself and others at risk, no matter which virus you have. Because let's say you had flu, then you're putting yourself at risk for catching COVID-19 or spreading whatever you have to other people who may not, survive it. So that's one issue. And of course, if you're sick and recovering from one thing, you're much more likely to catch something else, because your immune system is weakened, your body is weakened, because it's already in the process of fighting one virus. So then if you unfortunately come in contact with another one, you're in much bigger trouble than if you were already healthy to begin with when you got sick.
Definitely. I think another word out for our audience, again, please do go ahead and get your flu shots. It's so important this season. What is concerning you the most right now, Dr. Paikh, with everything going on, especially for this month and the next month?
Right. So I think what concerns me the most is that, because everybody is getting very tired of having to, keep wearing the mask, washing their hands, social distancing, and isolating themselves, that people will start letting their guards down and will unfortunately start getting sick. Even with the low, below 1% infection rate, I think people are still getting sick even in New York City because of that. It's that they're letting that guard down, because it's hard to be isolated for so long and to keep up these precautions for so long and stay away from your family. So that's my worry, especially around the holiday time. Thanksgiving, Christmas, New Year's, these are all times of the year where everybody loves coming together with their families. And I think it will be a challenge, because everyone's going to be inside. It'll be cold outdoors, and there will be much higher risk of spread. So that's my worry, before a vaccine is approved.
Another issue that's also impacting the nation, and parents especially, or young children or the youth of the nation right now, are the surges that we're hearing about in colleges and schools. Pretty much all of the 50 states are reporting surges in colleges, with many reporting positive cases. Campuses are trying to struggle between in-person and online learning. Some are quarantining their students if, a building has tested positive. Similarly, schools are also dealing with that. About 40% of schools and students in the New York City school districts are choosing to be in an online learning, experience. Could you explain your own take on this and what needs to be done? Should we be sending our kids back to school?
Right. This is a big challenge, because we know people do learn better in person, especially very young kids. They need that interaction. But the problem is, especially in college campuses, that in addition to the in-person learning, there is a lot of socializing, and a lot of people live together. So there's many people living together in dormitories, in fraternity and sorority houses. And so these are prime places where the virus can spread quickly. Another concerning thing about the college students is that their age group is not immune. Even in the first surge, we saw a lot of people in their 20s get very sick and even die. So it is very concerning, and I think it's going to be a challenge going forward, because while the in-person learning is very important, the social aspect of college and university, while that also is important in your growth and development, it can be very dangerous right now during a pandemic because a virus can spread very fast, and we're seeing that. So I think colleges are more at risk than even, elementary schools or high schools where people are coming from home and staying in, because at least they're staying in small groups, they're coming back to a controlled environment. So whereas in college, it's a lot harder to control that outside of the classroom environment.
Let me ask you something. If there was a parent watching us on ITV Gold right now, and they were really deciding between somebody in elementary school and they're trying to figure out if they should send them back to school or not, what do you tell them? Somebody in elementary school or a high school student?
Right. So this question has come up a lot to myself and my colleagues. So it really depends on a lot of different things. So it depends what area of the country you're in and what the infection rates are there. So if you're somewhere like New York or New Jersey where the infection rates are below 1%, then, I would be much more inclined to considering in-person learning versus other areas of the country where it's much higher. The other thing that I would want to know is what precautions the school is doing. So a lot of schools are doing hybrid. So they're not in the classroom every day, which I think is a good model. So it's maybe only 2 days a week where they're going and the rest of the time is at home. So that reduces exposure. Also, some schools are creating pods, meaning that, there's only a very small group of students that interact with each other only, and their teacher. That also helps reduce spread because then you know exactly who you're interacting with and, what those risks are. And you can control any spread and variables much more easily. And other factors too, I would, go to a school that required masks to be on if the child is old enough to wear it, required eating in their own classroom, bringing lunch if it's possible. I know many children rely on the school system for their food, so that's a different story. But I would really look into what the school is doing and what measures and protocols they're putting into place, and also the local infection rates, and be prepared to change. So even if it may be safe to send them now, in 6 weeks, be prepared to bring them back home if we see a second surge in October or November.
Wow. I only have 2 more questions left here. So let's get into it. I want to continue this one discussion on children. We have stats here about 500,000 children in the United States have tested positive for COVID-19 in total. Will this number go up significantly? And are you concerned about that particularly?
So the stats about it going up. Yeah. So I am concerned because that's not a small number by any means. And although children do tend to get a milder form of the disease, we have seen children die from COVID-19. We have seen them get very sick as well and end up in the hospital, in the intensive care unit. And we also know that children can pass it on to their parents and their grandparents who might not do so well. So yes, I think it's very concerning for multiple reasons. And the other thing that worries me is so far we don't have any pediatric vaccine trials. Everyone's very focused on adults, which is fine. But I do hope that these companies start including children too in the trials because they're a large part of the population and will need to be vaccinated as well.
Definitely. And my last question here is something different, but something that's also concerning the nation. There are wildfires happening across the west coast of the country right now. It's really impacting areas such as the Washington State, California, Oregon. Do you see that impacting, any lung complications in a patient? Do you see that impacting COVID-19 cases in terms of its surging?
Yes, definitely. Especially because I treat asthma patients, and these wildfires are very high risk for anybody who has any chronic lung disease. And in California, it got so bad at one point that it was even affecting healthy people. The air quality level was that bad. So anyone who has any type of lung disease, it's really bad because that particulate pollution in the air causes a lot of breathing problems. It causes a lot of inflammation in your lungs. And the problem is if you are having that inflammation and having trouble breathing, and then you catch COVID-19 on top of that, it can be very dangerous for you because, again, your lungs are already trying to process all the pollution from the fire. And then on top of that, you catch a virus. It's like a double hit, and you could end up becoming much sicker if let's say you weren't exposed to that smoke first. So it is a big concern from both regards. And also for those fires, they are recommending too the face masks, even the particulate masks, the N95s if possible, because a lot of that smoke pollution is very, very small particles that can get deep into your lungs and be very dangerous.
Wow. So we have a lot to watch out for, as always. It was a pleasure having you here on ITV Gold, Dr. Purvi Paikh. Thank you so much.
Thank you. Thanks for having me.